Hi there, good to have you. Honestly now, how much have you moved around today? Or if your day has only just begun, ask yourself honestly, how active were you yesterday? Or over the last few days? If the answer is, well, not really so much, then you're definitely not alone in that. That's how it is for most people who are in your situation. Because of cancer therapy and its side effects, it's quite possible that you're feeling really low and just want to hide away. But maybe you actually feel like doing some sports or moving, but you're not sure how to go about it or what's allowed. That's why in this video we'd like to talk about the topic of sports and exercise during cancer treatment. Did you know that many clinics now offer sports therapy programs for you? And that the sports and physical therapists can help you create an individual training plan that's right for you. That is, of course, without expecting any peak performance, always taking your medical condition into account. Exactly what that training looks like is very individual and depends on what you enjoy and what's possible in your case. The sports and physical therapists always consult with your medical treatment team about it. And what almost always works is so-called functional training, which is training meant to keep your body stable and fit overall. This can be, for instance, exercises with or without dumbbells to strengthen your muscles, or through training on a stationary bike to help improve your endurance. Or you could do a little yoga together if you prefer a more relaxed approach. The important thing is, it's not about performance. It's all about making sure that you feel better. Because sports and exercise help you to better handle the side effects of your therapy or even avoid them. If you're receiving chemo or radiation, you might be suffering from nausea and fatigue. Exercise can really help you feel less sluggish and tired. That's because physical activity always boosts the circulation and blood flow in your body, so that more oxygen reaches your muscles and organs. Plus, movement helps you to not notice the nausea quite as much. Some people also get muscle and joint pain from lying down so much, and sports and exercise help with that too. But there's even more happening. Because when you exercise, happy hormones are released. That's also the reason why you're often in a better mood after exercising than before. Most importantly, don't just train regularly, but also try to move around in your daily life on the ward and at home as much as possible. Generally, it's recommended to move for about 60 minutes every single day. But don't panic, it can also be very short bursts of movement spread throughout the day. For example, if you notice that you feel fitter in the evening, you could walk up and down some stairs then. And if you have to stay in your room, even small routines can also help. Like eating at the table or dressing yourself every day can help. In any case, it's always better to set small goals for yourself than not to move at all. Maybe you can also do a movement challenge with your family with a reward at the end to motivate yourself. And you'll see that over time you'll get a better and better feel for how intensely you can push yourself. In sports therapy, an exertion scale like this is often used for that purpose. With it, you can indicate yourself how strenuous you find the training to be. From super easy, yeah, to just can't do it anymore. And if you have a smartwatch, you can also see how you can use it to set small goals for yourself or, for example, to monitor your heart rate. It's just important that you don't compare yourself with others or with what you were able to achieve in the past. If your friends go to the gym, for example, you might want to keep up with them. But cancer therapy takes a lot out of a body, and some medications even prevent rapid muscle building. And that's exactly why you need your very own training program now and at your own pace. Sometimes the limitations after therapy or surgery are also permanent. Then it may be that your sporting activities have to be adjusted in the long term. Discuss that in your sports therapy. But as a rule, ways can usually always be found for you to still continue doing sports. And there are also special action days and retreats for young people who have a limitation after a cancer illness. You can also find out more about this on the Active Onco Kids website, which we've also linked below. So the good thing is, if you already start keeping yourself reasonably fit and training appropriately during therapy, it will also be much easier for you later to find your way back into your normal everyday life. Going to school, meeting up with friends, and doing things. Maybe you can also get friends on board to motivate you to reach your training goals at home. So keep at it, as well as you can right now. Every activity, no matter how small, will help you feel a little better.